Hello, I'm Dr. Matt Hogue with Hogue Chiropractic Center. We're going to talk this evening about adjusting pregnant women. If you've heard it's unsafe, not the case. It's very safe, very effective when done properly. This is my beautiful wife, Karina. We are 20 and a half, almost 21 weeks pregnant with our little boy. We cannot wait till he gets here. I adjust my wife regularly, and the fact that she's pregnant doesn't change that one bit. Pregnancies, first of all, as the baby gets bigger, mom's going to have to compensate to that, and that usually means she's going to be thrown more into extension as the baby grows, as the belly gets bigger. It's going to be at some point that the lower back muscles are going to be overworked. The joints, weight-bearing joints, hips, pelvis, lower back also tend to get inflamed. A couple of the key things that are going to be typically overactive as far as the muscles are concerned are these deep supportive muscles. The piriformis muscle, the upper glute muscles have to overwork as we throw ourselves into extension, or as she's holding herself into a more extended position as the baby gets bigger. That's going to increase tension and stress on two joints called sacroiliac joints, which are pelvic joints, allow for normal proper motion to occur at the pelvis. L5-S1, the last freely movable segment in our lower back as it adjoins to the sacrum. L4 as well, as we go into that extended position. It's only a matter of time for those joints to become irritated. So the adjustments there to help release that tension, improve motion at those joints. And again, we want to make sure we're using techniques that are safe for mom, safe for baby. But these muscles, which we have 4 massage therapists on staff, which are trained in prenatal massage, can get in and help address those deep tissue tension issues that have developed from those muscles being overworked as the baby gets bigger. So we're going to demonstrate here now on Karina how we adjust. And again, the techniques aren't really that different, other than we want to allow for no pressure on belly. And being my wife, I've evaluated and treated her 1,000 times before, so we're not going to go through the whole evaluation process. But we work with local doctors, OBGYNs. They refer to us on a fairly regular basis. If they have a patient, she's coming along through her second, third trimester, she's starting to get and experience the sciatic pain, the lower back pain, they're happy to refer them to us, and we'll help alleviate that tension to help pregnancy go that much more smoothly and hopefully pain-free. So as we adjust, this is a typical side posture positioning. All we really want to accommodate is the belly. So I bring her a little closer to the edge of the table so that as I put her in a side-lying position and now execute the move, we're not going to put any pressure on the baby, and he'll be perfectly safe. And she needs this. I didn't adjust her this morning because we were going to be adjusting her tonight. So all we really look to do is she drops that hip as we get that lower back to open up. We'll have her slowly turn over on the other side. We're going to adjust the opposite side as well. She's already starting at 21 weeks. She has a pretty healthy back, but starting to carry a little bit more pressure as the baby's starting to get a little bigger. She's starting to throw herself into a little bit more extension, which is going to, again, increase the downward pressure and forces on that lower back, and it's going to become irritated at some point. So our job and our goal is to keep good motion. So we want to make sure we have room for belly. We're okay there? Good. And as she comes to me, it's just simply applying a little pressure into that joint. We get it to open up. It moves quite nicely and on the back. Also, chiropractors have been somewhat labeled back doctors for good reason. We work on a lot of backs, but in our office we do a lot of work on extremities. In this case, the feet. And for you women out there that may have gone through 1 pregnancy, 2 pregnancies or more, and you've noticed the foot getting bigger, well, if skeletally we're done growing, the only way a foot will get bigger is if it elongates and flattens out. That means we've lost some type of arch support. So love to adjust feet on a lot of our patients and on our women as well as they're going through their second, third trimester. Almost all their visits will consist of a foot adjustment. So we'll do a little work on her feet, and pretty simple stuff. As far as our evaluation process, we're going to make sure that there's good motion through the heel and the midfoot. As there's more body weight going through that foot, if the arches have become affected, we're going to change the biomechanics of that foot. More to come on this topic here shortly. We're going to be talking a lot and in depth about foot and orthotic and arch issues when they exist. So always work on releasing tension at the foot, which make a lot of noise. Chiropractor's best friends are happy feet, right? Make noise. My wife thinks I'm an idiot, so she won't say much while the camera's on. Good, let's flip feet. I'm just kidding. You don't think I'm an idiot, do you? You married me. It's your fault. Good. So So we're checking the calcaneus, the heel bone. We also want to check the talus to make sure we have good motion there. We do this adjustment on a lot of our runners because those feet make some noise when that pressure starts to build from the impact. So what we'll have her do now, we're going to slide down just a little bit here. We'll bring the legs up to about a 45. Again, as the belly gets bigger, we like to do a lot of adjusting with the patient prone, but as the belly gets bigger, we can do that. We have to have certain tables to accommodate the belly. In this case, we'll just do some, check the mid-back to make sure she has good range of motion through the mid-back. Again, because of the lower back being thrown into extension, that's going to cause lower back and mid-back supportive muscles to have to overwork to accommodate that position. So we're going to come up just a little bit. Good. I like to try to assist as much as I can. Deep breath in and out. We'll let this come all the way back. Now all we're looking to do is get the mid-back to open quite nicely. We'll come up a little higher here, get a little lower, and usually right around the bra strap. That area, let's come on back. Deep breath in and out. Good. And straight back. That area we tend to get and ease on down. We get a lot of tension through the mid-back, and if you've had a child before, I'm sure you would agree with that statement. So just simple adjusting, releasing tension. Wasn't harmful, didn't hurt, did it?
Not at all.
We didn't hurt little baby Max either. He's still fine. But this is something we really enjoy taking care of all of our patients, but especially our women, because as they go through these pregnancies, it's hard on the body, and we want to try to facilitate and help ease that pressure, ease that tension best we can. Those are simple, basic adjustments. We can change our approach as need be, but hopefully that helps to ease some of her discomfort. I'll try to ease Jeff on up here. So we'll sit her on up, we'll slide off the side table. And that's really a pretty basic adjustment that we'll do. Sometimes it can get a little bit more intricate, a little bit more complicated. We try to make those adjustments, pick the right treatment for the right point in time to help alleviate the pain, alleviate the symptom. But if you know someone that is in their second, third trimester, or maybe even just found out they're pregnant and they're looking to try to make that pregnancy an easier process on them physically, please share this information with them. Our information will be up at the end of this video. Feel free to contact us. Give us a call. We'll be happy to schedule an evaluation. We can't x-ray, obviously, because of radiation in babies isn't a good thing. So we can't x-ray. It's the only time I won't x-ray a patient is in a pregnant person. So we try to do as much as we can palpating the joint and assessing muscle tension and formulating a treatment plan to help ease that pressure and help that pregnancy hopefully be that less painful. You excited?
Very.
We're very excited, by the way. We can't wait. So keep us in mind if you need us. I'm Dr. Matt Hogue with Hogue Chiropractic Center. We help to unlock your body's potential. Very good. Say hi.
Hi.
That's little baby Max. It's getting bigger.
Put that in there.
Gonna be bow hunter. Gonna be lethal.
It's just for us.
It's little Max.
Okay, back there.